Hi, I'm Dan. I'm an Associate Psychological Practitioner with NHS Greater Manchester. So I started the role as a trainee Associate Psychological Practitioner back in March of 2022. And the role, I think, was just sort of a bit of a bridge to bridge the gap between psychology education and clinical psychology practice. So in the role, I provide low-level psychological interventions to people who are registered at GP practices within my PCN. So often I'll be helping people with things like anxiety, things like depression, stress, generally give them sort of mental health tips and things to avoid in terms of those pitfalls of mental health. I tend to see people over 4 or 5 sessions, in which the first session will consist of an assessment, and then the rest of the sessions after that will consist of 3 or 4 intervention targeted sessions based on what they tell me in that assessment, and then as well as 1 follow-up session afterwards, in which we'll just make sure there haven't been any major changes, and then we can make any further referrals if we need to do so. So I've always been interested in psychology, from studying it at college level all the way through to university. And psychology has always been quite a competitive field, but I found this was a really sort of good opportunity. Like I said, we started off as trainees. It was done through the University of Central Lancashire. We received the training we needed to sort of do some clinical practice, and then after that we had some hands-on practice in the GP surgeries and received plenty of further support from both staff in the practices as well as clinical psychology supervisors who supported us throughout the role, providing us with further on-the-job training we needed, as well as my manager and mental health practitioners who were able to further support us in the surgeries. So I've got plenty of things to keep you busy in a typical working day. So I tend to have 4 patients in a working day, and those sessions usually last up to an hour. And that can range from doing an assessment with patients, gathering information from them, taking psychometric data, helping patients fill out questionnaires so we can get more information on their mental health problems. Also doing like interventions with patients, so this might mean doing sort of practical strategies to help reduce their sort of distress levels. Also making referrals for patients, providing them with sort of further information on what other services there are out there so they can sort of make referrals for themselves. I might be sort of doing research on more interventions or other mental health problems and how best to support patients with those problems, doing training for myself, just making sure I've got my skills up to date and developing myself so I can support my colleagues as well as my patients in the best way possible. It varies for certain patients, but I think I've made quite a bit of a difference in the lives of some patients. I think it prepares them for further therapies, but also I think it gives them sort of basic skills that they need to manage mental health in their own home. It gives them the tools to manage their own mental health, really. So I think the role has been really pivotal in supporting my colleagues in the primary care sector, because there's been such a deficit of mental health support in primary care and in GP surgeries. So I think it's really eased the stress off the GPs at a time where I know that they've been inundated with patients and referrals, and also GPs, I appreciate, don't have as much training in mental health, so I think having that place for them to refer over to me or even to come to myself just to ask for a bit of support on their patients has really sort of eased that pressure, and I'm really glad that I'm able to sort of relieve that for them.